Okay, so we are going to talk about empowering our community today. And one of the ways we can do this is by increasing health literacy. And we want our patients, our patrons, our community members to be their own patient advocates. And that's what we're going to talk about and focus on today. So a little bit about me. Who is Jessica Daly? Why should I listen to what she has to say about health literacy and about becoming my own patient advocate and enabling others to be their own patient advocate? Well, it begins with this picture of my family, and you just heard about them as well as my dogs. But really, health has been an issue for our family for many years. My husband found out in 2006 at the age of 28 that he had a cardiac disease called cardiomyopathy, which is unexplained heart failure. And from that personal journey and then being a librarian, the two worlds have come together over the years. And so I love to help empower other patients and family caregivers find all the health information they can to have the best health and best quality of life. So how do I do this? So over the past 6 years, I've done that in different capacities. I worked with Orlando Health as a consumer health librarian, which means that I worked with our patients and our families, helping them find health information. And then that really just grew and into something even better during COVID because people were really desperate for quality, credible health information. But I had to get to them where they were. So we became a fully virtual library, and we brought health information and health resources to people in their homes during quarantine. And then that really grew. And so I was able to connect with different groups throughout the community, like public library organizations, FLA, a very, involved in the work that the Florida Library Association is doing, and then even FISHLA and different groups all over the state of Florida. And that's actually grown outside of the state of Florida through support groups like the Stroke Support Group, National Stroke Support Group, and also Mended Hearts, which is a support group for those with cardiac disease. So, it even reached out to Rotary clubs and different organizations. Anywhere they needed a guest speaker, I was willing to go and share how people could become more health literate. So what is health literacy? Let's start with that. I know you may hear this a lot, but let's really break it down the way that I do for my patients. It really is your understanding of your health. Very simple. Do you understand your diagnosis? Do you understand your medications? Do you understand your treatments? Do you even understand why the doctors and nurses and your healthcare team have asked you to do certain things? And what I find when I talk to patients is they often do not understand. And here's what happens. When we don't understand our health, it doesn't improve. So health literacy is really a combination of where you get this information. Do you understand what you're given? And then can you use it to make the best decisions about your health? Well, guess what? You're also not alone, because this graphic is from the CDC, Centers for Disease Control, and it tells us that only 1 out of 10 people fully understand and can manage their health. And so that is an alarming number, and that's for the United States as a whole. So health literacy and health information is so important. So I love this because you have to know the benefits, and we're going to talk about that today, but you also have to know about the risk. So patients with low health literacy across the board, research has found that they have these 4 problems. They're more likely to visit the emergency room or the emergency department. They have more hospital stays during the year. They're less likely to follow their treatment plan, not because they're trying to be defiant to their healthcare team or their physician, but they really don't understand what to do once they get home, which will cause them to call the ambulance again and be back into the hospital. So it's this vicious cycle when there's not understanding. And then in the end, we actually have higher mortality rates for these individuals. People die every day because they don't understand their health and they don't know how to how to do their self-care. So that's where I'm just super passionate and want to stop these things from happening. So, what does strong health literacy look like? Well, the first one is just you understanding any diagnosis you have. So, that could be something like psoriasis on your skin, or it could be cancer, or it could be all kinds of things. But whatever you've been diagnosed with, I want you to fully understand what that means and what it does to your body. I want you to understand all of your information when it comes to medications, when to take them, how to take them, what the side effects are. Also, understanding any treatments that you're undergoing. Why are you doing these treatments? What are they doing to your body? What should you expect as you're going through the treatments? All these are very important questions that you need to have the answers to. And then understanding self care. It's easy often when we're in the hospital or when the doctor's office and they're taking care of us and they're taking charge. But once they give us those instructions and we have to go home and take care of ourselves, it can become very confusing or even difficult. So that's something we're going to touch on today too. And then I always want you to understand the risks along with the benefits of doing certain things when it comes to your health. I want you to know how it can help you, but I also want you to understand why it can hurt you. Let me give you an example. We often tell people, don't smoke, it's bad for you. But do we really explain to someone who's never known about the dangers of smoking what it really does to their body? That's what I want to start doing, not just telling people what to do and what not to do, but helping them understand why. And then the last piece of the puzzle is how you communicate with your healthcare team. Communication is everything. And if you don't have that open dialect with your healthcare team, your health professionals, that also can really inhibit you from having the best health possible. So, how can a library patron become their own patient advocate? This is if you work in a public library, if you work in a university situation like myself, if you work in a hospital, if you work for a medical organization of some kind, if you're a researcher, all of these things. How can someone become their own patient advocate? Well, that is what we're going to discover today. And I hope I give you some tools so that you can really do this not only for others, but for yourself and your own loved ones. Okay, the first thing is, and hopefully all of us are, we're here today, we need to be inquisitive and ready to learn. The worst thing I hear sometimes from patients or even students when I'm working with it is, oh, I'm good. I know all I need to know about that topic. Oh my goodness, no. None of us know everything there is to know about every healthcare topic. And there's always something to learn. So here's the example I give people. With my husband, he's a cardiac patient. And so with congestive heart failure, that is something that there are new developments, new medications, new treatments. Things are being learned every day. And so even the treatments he had at the beginning 16 years ago are so different than what's available to us now. And so we're always wanting to learn. We're always wanting to know what are the newest things, the newest research when it comes to congestive heart failure. And I want my patients and I want community members to be the same way. Be ready to learn all the time. So before you even go into the physician appointment, these are some things I want you to think about. I want you to list all of your questions, write them down or put them in your phone, however you're more comfortable. I use technology a lot, so often I'll put them in the notes on my cell phone. But I also like to write things down. I'm very old school that way. And so, however you want to do it, have questions prepared before you enter the physician's office or before you go into the hospital for a treatment or a surgery or anything like that. I want you to share your concerns and your fears, and we're going to touch on that. Share information that you have found with your physician. Not long ago, at an appointment for my husband, I had done some research on some things, and I shared that with his physician, and she was really excited that I took the time to do that. And she then had a conversation with us about that information. So anything you find on your own, I want you to share with your healthcare professionals. I want you to take notes. Or this is something new that I've had people start doing is ask your physician.
That second bag of rock salt, should we return it?
So I want you to share your conversation. And if you would like, I would like you to record it on your phone. The other thing you can do there is you can actually FaceTime with another family member. Say you need to go alone and someone else wants to know what the physician says, just always ask them ahead of time. But it's also good to record self-care directions, things that they tell you to do once you get home. Also ask for that in writing because that would help you. And then you can also take notes or record medication instructions or directions. But ask also before you ever leave an appointment how you can contact your medical team for follow-up questions. Can you call? Can you email? There are now a lot of what you call patient portals. That is like an app on your phone or computer, and you can even send messages through that. So be aware how you can communicate with your healthcare team. Okay, now this is one that is tough, but it is really important, and that is understanding our health insurance. So it can be really overwhelming, it can be complicated, but I encourage you to understand what your coverage is, what your benefits are. A lot of times we don't use all of the benefits that come along with our healthcare plans. So if you don't know, take the time to call them, ask them questions, know what to expect. The worst case scenario is finding out that something isn't covered or that there's an issue in an emergency situation. So make sure you understand your insurance and reach out to that company and ask them questions. I want you to ask anyone questions. Please do not feel that you look uninformed or you look dumb or you are perceived as ignorant. No, unless you are a trained medical professional in the area that you need help with, you're not an expert. And even as a medical research librarian, I do not ever say that I'm an expert on any healthcare area, even those that affect my own health and my family. There is always something for me to learn. I asked a lot of questions. And let me just say that I've never had a physician or a nurse or anyone on our teams, our healthcare teams, say, "You ask too many questions. Please stop asking us questions." No, they are very open to do that. I also encourage you to ask them about things you don't understand, because guess what? Unless you're a physician or a nurse or a medical care professional, you may not know a lot of medical terminology, and you also may not know a lot of acronyms. You hear things like you have COPD or we're going to do an EKG on you. Well, unless you understand what those letters mean, what they stand for, you may not know what someone's talking about. So ask. Tell them, now, can you tell me that in plain language? So let me give you an example. Often we're told in a doctor's office that we have hypertension. Well, some patients think that they're being told they're hyperactive. No, hypertension is the same as high blood pressure. So I also encourage healthcare professionals to use both plain language, which would be high blood pressure, as well as medical terminology, which would be hypertension. It's good for us to know medical terminology, but we've got to pair it with the plain language. It really is important for us to ask any question we want at any point in a healthcare visit, hospitalization, anything happening with our health. Okay, so we touched on this, but we're going to talk about it a little more now. It is so vital for you to keep personal notes and your own health records. You never know when you may need them. You never know when you want to look back and see, have I taken this medication before? Have I done this before? Was this something that worked? It didn't work. Let me tell you also why this could be very important. If you're like my family, we've lived in 3 different states in the past 10 years. So we are born and bred in North Carolina and lived there many years. Then we moved to Lynchburg, Virginia, lived there for 3 years. And now we've been in Orlando, Florida, going on 6 years. So each time we made a move, we had to start with new physicians. And that can be a very daunting process. It really can be. And so having everything together, knowing how to get those records transferred, having copies of those records really can benefit you in the end. And if you have long-term or chronic illness, then you really may have even forgotten some things. So it's really important to keep track of all your medical records. The other thing with that is to keep up with what each physician tells you, what questions you asked, what answers you received. You want to look back at those things. So again, this can be in written form, in a notebook, or it can be on a laptop, iPad, or even your cell phone. So however you feel more comfortable, but keep those records where you can access them at any moment. Okay, so this is something that I really get on my soapbox about, and I really tell patients this is important. It is okay to ask for a second opinion. It is your right as a patient, as an individual, to ask for a different opinion on your health before you proceed. So here's the story that I tell when it comes to this. Several years back, my dad was diagnosed with kidney cancer. And thankfully, his cancer was encapsulated within one of his kidneys. And the surgeon that we went to, which was highly recommended, said that he felt we could remove my dad's kidney and that he should be fine because the cancer, again, was encapsulated inside. Well, we left the appointment. My dad was ready to go. And my sister and my mom and I looked at each other and said, nope, we're getting a second opinion. Before an organ is taken from your body, we want another physician to tell us that's what he or she would do. Well, my dad wasn't very happy about that. And so we pushed that and he went to a second surgeon and the surgeon agreed with the first. And so the story really gets funny when the morning of my dad's surgery, back with the first surgeon, my dad apologized to the surgeon before surgery and said, I'm so sorry that my wife and daughters wanted a second opinion. And I love it. His surgeon looked at him and said, let me tell you, they're right. You should always get a second opinion, especially with something major like this. He said, several years ago, I had to have surgery and I got 3 opinions before I let anyone have, do surgery on me. And so that was really great for my dad to hear that even the physician wanted several opinions before he moved forward. So do not be afraid to ask for a second opinion. If you ever have a physician that doesn't like that or gets offended, you need to stop going to him or her. That is a warning sign because a good physician always wants you to, consult with others and make sure this is the right decision for you. Okay, discussing our concerns and fears. And I told you we were going to touch on this. This does get personal. This is for every individual. You have to share with your physician, with your nurse, with your healthcare team, what you're concerned about, what you're fearful about. So let me give you some examples. Let's say that you're very fearful of needles, but you're going to have surgery and you're going to have blood drawn from needles, an IV put in for fluids or medications during surgery. That's a needle. It's good to let them know that. Let me give you my personal example. I can go have blood taken from myself, but I cannot watch it. When I watch it, I pass out. Don't ask me why that happens to me, but it does. So before I ever have blood drawn for any reason, I always tell the phlebotomist or whoever is about to take my blood, I can't look. I have to look away, and they are fine with that. For instance, let me just tell you, my husband, his fear above all else, even with heart failure, is throwing up. So we tell everyone when he has a procedure or he has anything done, his greatest concern is being nauseated and getting sick. You know what they do? They give him nausea medication. And so it's really good for you to share what your concerns are, what your fears are, so that they can help you better understand and cope with those things. Okay, so we need to know our risks and how to manage them. So, the more risk factors you have, maybe you are a smoker, maybe you have high blood pressure, diabetes, then you're at greater risk of other health situations, and you need to be aware of that. That's why we ask you to control those things and to manage them in the best way. It could be through diet or it could be through medication. When it comes to smoking, I want you to stop smoking if you do now. It hurts every cell in your body. It is very detrimental to our health in many ways. But also, it concerns our exercise and diet. So let me just be very transparent with you. Food, I have pretty much under control. I've been working on my diet for the past 4 years. It's been an evolved process of me just learning what foods do to my body. I was addicted to processed sugar. I still love it. It tastes so wonderful, but it's not good for my body. Caffeine, I loved Diet Cokes, was addicted to them, but the aspartame and the caffeine in those were horrible for me. So it really just is your own personal process. When you see how you feel differently when you eat different foods, that's where your breakthrough is going to come when it comes to healthy diets and healthy living. Let me also tell you, somebody could have said to me years ago, Jessica, you need to eat more vegetables. And I was like, no, I really don't. It's fine. No one ever explained to me what vegetables do for my body. Now that I know, it's my power source. So not only can I figure out ways to cook them that they taste good, but they make me feel good. And as I age, I'm 48. I want to feel good. That's my number one goal. And so that's why eating is important to me now. Now, I told you I was going to be transparent. Exercise is not my friend. I don't love to exercise. My friends that run and, you know, play tennis and they're so active, that is fabulous. That is not me. I'm not a sports person. I love to watch sports, but not participate. But I have to find ways to move. And that might be walking my golden retriever, which is a workout, or it could just be a walk around the neighborhood with my husband or hopping on the treadmill. We just got a rowing machine, so I'll have to get back with you on how that's going to be. But I've heard that that's a really great quick workout. So we'll see how that goes. So the other thing is know your risks and what to do to control them or what to do to reduce that risk. So for me, many years ago, about 4 years ago, that's when my diet changed. I was told I had hypertension or high blood pressure. My mom has it, my dad has it. They are on medications. I did not want to have to go down that road. And my doctor told me, I'm going to give you 1 month, Jessica, to change the way you eat. And if you'll change the way you're eating, I think your blood pressure will come into control. Well, it did. And I got serious because I don't want the issues that my parents have. We can break that cycle. Can I just tell you that? Hereditarily, I might be destined for that, but I can do things in my lifestyle that I can control to make that less of an issue or a risk for me. Okay, so I want you to understand your treatment plan. That is so important. And often I talk with patients that they do not understand their treatment plan. They don't understand why they feel the way they do. So let me just say the first thing is to talk about options. So let's say that you're diagnosed with cancer. Then the first thing you need to know is, what are my options? Are there different treatments? Are there different medications? And investigate all those options before you make a decision, because every person is different. And so what works for you may not work for your sister or your best friend. So it's important that you know all the options. It's important that you talk about all the details of those options. And this I actually pulled from the American Cancer Association. So it does have the word cancer in there. But know your options. That could be your options for recovery or therapy or occupational therapy, physical therapy. It could be medications that you're taking. It could be any kinds of things depending on your diagnosis. But learn as much as you can and use the information that's been given to you. And let me stop right here and say, make sure you're asking for information presented in the way you learn best. So if you're a visual learner like myself, I like a video. I like to watch a video. Just the other day, my husband had to wear one of the continuous monitoring glucose monitors that kind of pop into your arm back here, and you wear it and it keeps up with your glucose levels. He's not diabetic, but he's hypoglycemic, which means he has severe highs and lows. And so we're trying to control that with diet. And guess what? We are. After 4 weeks, he has not had a hypoglycemic episode or his sugar level, glucose level going really low very quickly. So it's been amazing to see what food is doing to his body. But the doctor wanted him to wear this monitor in his arm so that we could actually physically see the results. Well, that's what we did when we had to put the monitor in and take it out. I went right on YouTube, saw how to do it because I'm a visual learner. Okay. Also, you may want to print something out and read it. You may want pictures. You may want to listen to a podcast. So tell your healthcare team how you would like to learn. Ask them to give you links, websites, different places you can go to find out about your health. The next thing is you're a partner with your doctor. You really are. We've touched on it, but I will say that the doctor is the expert in medicine. You're the expert in your own body. I want you to hear that. Your medical team, they are experts in medicine, in the science of medicine. You're an expert on yourself and your own body. They can't feel what you feel or understand exactly what you're going through unless you verbalize that and explain that to them. And so you have to work as a team in order for that care plan or that treatment plan to be effective and work. Okay, I moved that over so I could see that better. Here we go. Okay, this is a biggie. I do complete sessions, 30 minute, sometimes hour sessions on medication safety and understanding your medications. Let me just tell you that medicine, whether you buy it at the drugstore over the counter or whether you get it in a prescription, can be very dangerous if used improperly. And so there are things I want you to begin to ask your physician and ask your pharmacist. I can't tell you enough how important your pharmacist is. Know who they are, have a conversation with them, introduce yourself. You know that little window at the pharmacy that says questions or consultations? Go to that window. Did you know that you can call the pharmacy and request for a pharmacist to give you a call back? You can also set up an appointment with your pharmacist so that they know you're coming and they're ready. You don't want to go and it's a busy time and you've got to sit and wait for a long time, but it's so important to talk to your pharmacist. They are experts on drugs, on medications, and you can share with them some concerns, share with them, different questions you have. So the questions here, I want you to talk with your physician about, but also be open to discuss it with your pharmacist. So let's look at them. Number one, what is the name of the medication? Do you know how often I ask patients, what medications do you take? I take a blue pill and a pink round pill and a white pill. That doesn't tell me anything. I want to know what the names are. And let me say the next one, know the regular name and the generic, because if you can get a hold of a generic drug, please do that. It's so much more economical. It's cheaper. It's the same drug. But at the same time, you need to know both of the names of the drug. The other thing I tell you right now, a little tip, have these things written down or saved in your phone. They should be on your person at all times. You also want your loved ones to have that. So let me give an example. About 3 years ago, my husband took a medication that reacted poorly to him, and we had to call the ambulance. We had to call 911. That's okay. It's what you're supposed to do. But when the EMTs arrived, what's the first thing they want to know? I need to know what medications Mr. Daly has taken and what he is prescribed. So he has a list on his phone and in his wallet written down. I have the same thing. So I was able to run to my wallet, grab it out, hand it to them really quickly, because oftentimes it could be a life or death situation. You want people to know what medications you take. Also, let me get very, kind of in a bad place, but just being honest. Let's say that I'm out shopping and I pass out in a store. The EMTs could look in my wallet and see that information. Let's say that I'm in an automobile accident and I'm passed out, or I'm not where I can speak or tell them what my medications are. They're in my wallet, they're on my phone. So it really is important for people to have that written down. What is the medicine supposed to do? Why are you taking it? Do you know how many people I ask, why do you take this medication? I don't know. The doctor told me to. And I almost go into shock. I'm like, what do you mean? Why are you taking this? So make sure you know why you're taking it. How and when do I take it? And for how long? Is this a long-term medication? Should I take it in the morning? Should I take it in the evenings? I can't tell you how many people would tell me, Jessica, I have terrible trouble sleeping. We come to find out that the medication they take at night actually wires you, makes you awake. So they're supposed to be taking it in the morning. Same flip of that. People take medications in the mornings, feel terrible and groggy all day. They're actually supposed to take it at night. So talk and find out when you're supposed to take it. What is one dose? Don't overdose or don't take too little. Here's an example that I'm really, again, you'll find out I'm transparent. I want you to learn from my mistakes. Years ago, I had very chronic migraines. The older I've gotten, the more they have gone away. But at one point, I had to take migraine medication on a daily basis. It was making me feel really bad. So instead of telling my physician that it made me feel very groggy, very sleepy, very out of it, I just cut my pills in half. Well, come to find out, soon after that, I had a migraine. And when I talked to my physician about it, I told her, I said, I don't know why I had a migraine. And she said, are you taking the dosage I gave you? And I said, no, actually, I cut them in half because they were making me feel bad. And she said, Jessica, at that half dosage, it was like taking a placebo. They never even helped you. You were taking the minimum amount that would help you. So I didn't know that, and I was hurting myself because I was trying to self-medicate. So don't do that. Talk with your physician. If it's making you feel bad, tell them. There are so many other options out there for every type of medication. Not going to go through all of these, but should I take it with food or not? What happens if I miss a dose? What should I do? How often should you have it refilled? What are the risks if I don't take it? Know what those are. And then always ask for less expensive medications. Is there a drug program? Is there a pharmacy that has cheaper? Sometimes your doctor can even give you a coupon or some type of online coupon that you get the medication almost for free. So ask about these things. Don't be embarrassed. Okay, I want you to bring someone with you. And let me just say, I understand maybe you're a private person. Maybe you don't want everyone knowing everything that's going on with your health. But I hope that you have someone in your life that you can trust enough to take with you to appointments, especially very important appointments. If you're getting results back, if it's, you've been diagnosed with a very serious illness, it helps to have someone with you. It doesn't matter your age. Don't be embarrassed or think, oh, my daughter or my son thinks I'm elderly and they've got to go with me. No, they really love you. They care about you. That's why they want to go with you. And let me say, my husband and I are both in our 40s. Ever since he was diagnosed, and even when I have health issues, we go to appointments together. It's two sets of eyes, it's two sets of ears. And what happens is we often get in the car after an appointment and have like a debriefing. So we say, oh, what did you think about this? Let me tell you, every time he will miss something and I will miss something. So it's so important to have that other person there with you, even if you want the other person to take notes for you or record the appointment or just be there for moral support. It really does help. Okay, so where can you find trustworthy information? The internet is full of misinformation, information that is made up, that is not from credible sources, information you cannot trust. So my job is to give you the tools and the resources that you can trust. The very first place, and we're going to talk about it a little more in detail, is called medlineplus.gov. This is a medical search engine developed for patients and families by the U.S. National Library of Medicine. And so we're going to look at that. And the next place that I really encourage patients to go, it's very user-friendly, their website and great information, is the Mayo Clinic. I also encourage patients to go to the Cleveland Clinic. And then national health associations are always a great place to start. That would be the American Heart Association, the American Cancer Society, the American Stroke Association. So these are places that are more specific to your diagnosis, and you can also find their additional information, support groups, all kinds of things to come alongside you and help you with your illness journey. And then the NIH, and you might hear that acronym once in a while, especially on the news or from your physician, and that's the National Institute of Health. And there's many divisions. So when you go there, they have sections on every health, diagnosis or health area there is. And so it's really a helpful website to go to. And then I know in the past couple of years with COVID and everything that's going on, we're all now aware of what the CDC is, Centers for Disease Control, but they have a great, excuse me, they have a great patient-centered website that has lots of information that is designed for the patient in mind. So there are videos there are information, things you can print out, things you can talk with your doctor about. So these are great places to start. If you go to these places, then it's safe, credible information. I told you I was going to talk a little more about Medlineplus because this is the crown jewel. This is where I send all of my patients, all of my families, all of my community members, all of my librarians and researchers, everyone that wants to know more about their health. This is my #1 referred website. The reason behind this is, number one, it is sponsored by and maintained by the National Library of Medicine. Also, there are no advertisements here, so there's not going to be any bias. That's where you run into issues. I'm not against WebMD or websites like that, but they are funded by sponsors. So people pay to have their information on those sites, and that can often be misleading or unbiased information, as I stated before. So I really ask parents, patients, and families to stay away from those sites and to go to places like Medlineplus. This is a medical search engine. It has so many different facets to it, but it's easy to use. If you take a look up top where it says search Medlineplus in the box in the top right-hand corner with the little green go button, you just put the topic there. It could be, ingrown toenail. It could be heart attack. It could be as minor or as serious as you can imagine. And they're going to have websites there for you to go to. They're going to give you websites that are designed for the public, not just for medical professionals. Here's what happens when we go to Google or we go to Yahoo. When we go to a regular search engine and we put in a topic, you're going to get false information. You're going to get good information. You're also going to get a lot of information that's written for clinicians, for clinical staff, for physicians, for nurses, for anesthesiologists, for therapists, for people that are medical professionals. And it's written for them. It's not written for us. So it would be very hard to understand. Now, with that said, Medlineplus is going to give you also the most up-to-date information. And that's what's so important for me. Often I would have patients over the years come to me with an article from the Mayo Clinic, great source, but the article was 5 years old. Let me tell you, when it comes to cancer or any other healthcare diagnosis, I want what happened last week, not 5 years ago. So we want the most up to date. So when you go to Medlineplus, everything on the websites they lead you to is going to be updated continually. So this is a great source to share with people. And you can be confident when you tell someone, go to medlineplus.gov, look up your information. It's great things there. You can feel confident that they're getting the most reliable and the most timely information. The other thing I love here is if you also look under that green go button, it says Espanol in orange. This website is 100% translated into Spanish. So what an amazing tool for us to use. Now, when it comes to our other languages that I help patients with over the years, I had French, Chinese, Vietnamese, Portuguese, I had Haitian Creole, I had every language you could think of. Now, all of those are not represented on this website. Let me just say that. But I do encourage you to go to a librarian, look up references. If you need my help, you can reach out to me. But there is medical information out there that is trustworthy in those languages. And that's what I did for years. I helped patients find that information in their language. So some show up here on this website, but this is mostly or primarily English and Spanish for this website. Now, I'm going to give you a very important tool that is free, and this is a free patient health research website and also number that you can call. This is the library that I worked for years before I transitioned to be a faculty librarian and assistant professor with Advent Health University, but I'm still partners with these amazing people and they want to help you. It's called the Clifford E. Grace Community Health Library. This is the phone number and also a way you can email them. So let's say that you just found out that you have diabetes. We'll go with that. Then you could reach out, email them and say, I am a patient. I was just diagnosed with diabetes. Can you send me some really great resources on this for me and my family? And they will do that for you. So this is a great resource. I want you to reach out to them if they can help you in any way. Okay, so as I finish up, I always have to show you where I got my information because I always get information online from free, credible resources that you can use for yourself, as well as any of your patrons or any of your students that you come in contact with and you want to help them find out more about their health. So the first, of course, is Medlineplus, health information from the National Library of Medicine. Next is the NIH, or the National Institutes of Health. Then Centers for Disease Control, the CDC. Also, the American Heart Association. I pulled some things from them, and the American Cancer Society, because they have a lot of great information about becoming your own patient advocate and ways to do that, steps to take. So these are the websites I use. I encourage you to visit all of these websites yourself. They are great resources that are free to you and really can help you on that journey as you become an even better patient advocate for yourself. All right, so Deborah, I'm going to hand things back to you.
All right. Oh, sorry.
No, you're
so
good.
We've had some pretty good engagement and some questions in the chat. First and foremost, someone complimented your awesome accent.
Oh, yay.
So they missed theme there. So that's a good thing.
Oh, awesome. Thank you so much.
And the question asked was, sometimes you don't know enough to know what to ask about. Is there a generic list of questions that are a good starting point? for the doctor, nurse, surgeon, and most healthcare issues?
Absolutely. So I encourage you to just literally go online and Google questions to ask my doctor. You can do that through any of the sites that I gave you. If you do that, you'll get lists. But really, it is very easy to find lists online for that. And it is a great starting point. Like that was a great question, because if I'm going to say I'm going to the dermatologist for the first time, I have no idea what I even need to ask them or what they need to be looking at. Or so I think that was a great question. So really it's simple as going online and just saying patient questions, or you can go to NIH or CDC questions to ask my doctor. Or another search I do is effective doctor visits. How can I have an effective doctor visit? So that would give you some tips and some ideas, of how to start that conversation. That was a great question.
Absolutely. Having that language can be essential.
Yes.
You have some appreciation in the comments for sharing your personal experiences. That is making the content even more powerful for folks. And I agree with that. I was kind of noting that myself. You have another comment. Someone works with patrons who are blind. Often hospitals give them printed information that they cannot read. What rights do patients with vision loss have in asking for accessible information?
Okay, so I am very on track with you. That is something that I will use the word frustrate instead of infuriate. It is really difficult for patients that have disabilities in any form or fashion. Number one, you have to speak up for yourself. You have to say, in this instance, I'm blind, so I can't see anything that you give me. You sometimes have to actually say that. Like it seems so obvious, but it's not. I worked with several patients that were blind over the years, and it's amazing that they would tell me that they would give them written information. Now, let me say, in defense of our medical folks, sometimes they would give written information to the caregiver or the friend that was with them, which is great too. But I remember a patient that came to me a couple of years back before COVID. We were in the library and she stopped by one day and she said, Jessica, I'm blind. I'm legally blind, and I have breast cancer. So can you hook me up with some podcasts and some videos that have really great audio information that I can listen to? Is that something you could do? And of course, I was thrilled to do that. There absolutely is tons of that out there. So it is there, but we have to say to them, I need you to lead me to some good sources of audio, or again, video. When I say video, a lot of the video just has great audio to them. So, this particular lady said, definitely give me links to videos because I can listen to them. So, and a while back I had a patient call me, and she was also blind, and she said, I need information, but Jessica, can you look it up and then I record you telling me the information? So that could be another thing that patients that are blind could do. And the same thing if you're hearing impaired, tell them I need everything in print, I need everything visual. So yeah, that was a great question. But again, that person has to be their advocate and speak up and say, you must give me information about my health in these formats.
That ties in nicely with the next question. You got some kudos for the reminder about recognizing yourself as an expert of your own body and partner with your doctor. But one of our folks struggles with themselves with feeling confident enough to speak up with healthcare professionals. What advice do you have for recognizing your own expertise and not feeling afraid of a power dynamic between doctor and patient?
Absolutely. So this is something that is very common. Believe me, I've felt the same way. I think the older I get, the bolder I get, and the less I care what anyone else thinks. But guess what? They work for you. You're paying them a lot of money. You're taking your time, you're trusting them with your health, with your life. So guess what? You're in charge. And I say that to physicians and nurses, and the good ones agree with me. And they want to hear from us. when we don't communicate and share with them, they're doing the best they can with like little to no information. Often I hear physicians and nurses share with me, I love patients that speak up. I love patients that question me. I love when they come in with information written down so that when they leave, I know I handled all the questions they had. So I think the biggest part you have to understand is you are in charge. It's your body. It is a life or death situation. You want the best life possible. You want the best health possible. So one of the things I think is important is to find a physician that you click with. And some people look at me funny when I say that, and they're like, no, Jessica, I just need the most acclaimed and the smartest. And I'm like, no, you need the one that can talk to you. You need the one that you feel comfortable with. And there is a such thing as doctor shopping, and it's not something to be shameful of. When you go to a doctor you've never been to, you have no idea how that's going to be. Let me tell you, I've had excellent situations that I loved. I knew we clicked from the start. I've been before and thought, this is not working. This is not going to happen. We're not on the same page. And it's okay. I can't stand when I hear people say, I can't stand my doctor. I hate going to my physician. And I'm like, what? There are so many doctors out there. Find the one that fits you best. Find the one that you're comfortable with. But again, you got to have that confidence that you are in charge of this situation. It's your body, and you've got to speak up. Now you can, if it would help you, take someone with you that's maybe a little bolder that would help you with that. I think that's a great idea until you're more comfortable. And here's what I've told some patients that are ultra shy and very intimidated: write your questions down or type them up and just hand them to your physician. Just say, I'm really nervous about this, so I wrote everything down for you. That's a great thing. Then your doctor can address each of the things and you don't really have to do a lot of talking, especially if you're an introvert or that kind of thing. So there's a lot of ways you can make it happen, but it is critical for you to not be afraid. Guess what? They're people. We've always put, and I say this to them, I love them. We put doctors and physicians and PAs and nurse practitioners and nurses on this pedestal. And you know what? They're learning about health every day too. They're not, the know all end all, and good ones will tell you they're not. They're learning all the time. So they are people. They get up like we do. They go to the bathroom like we do. They have problems and issues like we do. And they have to go to healthcare professionals too. So just keep that in mind. If you ever go to a physician and they make you feel small or make you feel less than, do not go back. That is not where you need to be. So I probably said too much, but I'm just really passionate about that. It's just so important for you to have physicians that you feel like you can talk to. That is just critical.
I don't think you said too much. Giving us these tools to share in our communities is really important.
Yes.
This is a timely question as we've all dealt with some misinformation in the last few years. How do you teach patients to look out for bad actors and organizations who are spreading health misinformation? Examples are social advocacy groups spreading misinformation instead of professional medical associations.
Absolutely. I tell people anytime you hear something, find out what the source is. If people give you information or data, ask them where they got that data. If they can't trace it back, if they can't share with you a source, you don't need to listen to those people. And let me just say too, that different groups will skew numbers, will skew data so that it works in their favor. I love a while back, I did a webinar with MLA, and it was on numeracy and how medical data and numbers are used in wrong ways for patient information. And it was just so enlightening. And they gave the example, they could say, 8 out of 10 patients love this medication, and they only gave it to 10 patients. We need more data than that. When we look at percentages, how many people did this treatment? How many people took this medication? How many people thought this doctor was a 5-star doctor. Was it his kids and his wife? We don't want to do that. So, you have to know where these numbers are coming from. So anytime you see information online, find out where the information came from. If they can't give you a source, then I would not use that information. I would be really weary of that. Yeah. And that is out there. And let me say this too, even credible organizations, as they learn more, will change their data and change what they tell you. That's just like during COVID. The information we had day one COVID in March of 2020 is completely different than what we know now. So understand that as well, as things change. And that's why I tell you, I want you to have the most up-to-date information. Think if right now someone wanted to learn about COVID and they just looked at information from March of 2020. That would be so, misrepresentative of what we know now. So understand that too, that information, they learn more, things do change, but it is important what sources you're going to. And if your doctor gives you percentages or gives you information, ask them where they get that information from. That is not a bad question to ask.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.